Hi friends, I'm Dr.Priti Vyas here again today, continuing with my education series. Today friends, let's talk about fibroids. What are fibroids? It's so common, everybody has fibroids, right? No, actually only 1 in every 4 women has a fibroid, and not all fibroids are ones which give you trouble. But we need to know what are they. Fibroids are basically benign tumors of the uterus. What is benign? It is something that is not malignant. It is a tumor of the uterus which is completely hormone dependent. So it grows as long as the hormones in a woman are active. Once the hormones are not active, the fibroid tends to settle down or stop growing. They basically happen to grow in the body of the uterus. Now they can vary in size from less than a centimeter to even 15 centimeters in size, and they can also vary in the position. Sometimes they are within the body of the uterus, sometimes they are in the cavity of the uterus, and sometimes they are outside the body of the uterus. Depending upon where the position of the fibroid is where the problems or the symptoms of the patient would arise from. So a patient can have extremely heavy bleeding and a lot of pain during menstruation, even if the fibroid is less than a centimeter in size, if it is in the cavity. But sometimes a fibroid which is as big as 10 centimeters will not give any bleeding or pain to the patient because it is lying outside the body of the uterus. Most common symptoms that a patient comes to us with is either bleeding, pain, infertility, that is issues regarding able to conceive, or sometimes they have pressure symptoms because the fibroid is pressing on the rectum or it is pressing on the urinary bladder. They have issues passing stools, they can come with constipation or persistent diarrheas, or they come with issues while passing urine. Sometimes we even have patients where they are not able to pass urine at all because the urine lands up getting stuck behind the level of the fibroid. Why do these fibroids happen? It is because of the estrogens in a woman's body. Now these fibroids can be diagnosed by clinical examination when a gynecologist would see the patient, and also by doing sonography for the patient. Depending upon the size and the position and the symptoms of the fibroid, a treatment has to be charted down. Very small fibroids not giving any symptoms to the patient can be actually left alone. We don't need to do anything for them, we only monitor them. So we ask the patient to come for a sonography every 6 months or every 1 year and see how the fibroids are behaving. But if they are giving symptoms in the form of bleeding or infertility or coming in way of getting pregnant, or they are giving repeated miscarriages, then definitely they need some type of treatment. Now the treatment can be medical or surgical. Most commonly, all these years, we have always been operating on the fibroids by removal of the fibroids. This can again be done either with an open surgery or laparoscopically, and both have their own benefits. With a laparoscopy, of course, the patient has quick recovery, quick in, quick out, less bleeding and less morbidity. Only thing is, when we remove the fibroids, we have to break it down in small pieces. Because of that, there is always the risk of seedling deposition of the small tissues of the fibroid. To prevent that, we sometimes put the fibroids in a bag. There is actually a medical bag available that is used for doing morcellation, that is cutting the fibroid into small pieces by putting it first inside the bag. Or if it is a very big size fibroid or we don't want to do morcellation for whatever reason, then we can even do an open surgery for these patients where only the fibroid is removed but the uterus is saved. The last resort for a fibroid, especially if a woman has completed her childbearing and does not require the uterus anymore, would be removal of the uterus along with the fibroid in toto. Nowadays friends, there are even medical treatments available, there are tablets available. Of course, we give them only to a certain group of patients, especially when they are close to menopause or when we are waiting for that patient to become fit for surgery, when we need to reduce the size of the fibroid, we need to stop the bleeding for some time. But this is depending on what the patient needs and what her symptoms are. Friends, if anybody has a fibroid, she doesn't need to suffer. She definitely can take help of a gynec and get treated for fibroids. Thank you. Friends, next week I come up with high-risk pregnancies. Stay tuned to our channel. If you like our video, please subscribe, like and share our videos. And if you want, you can press the bell button that will help you to get the fresh updates every week.